All right, if you are a medical student or a medical graduate from countries such as, let's say, Nigeria, India, Pakistan, the Philippines, China, and you're looking to travel to the US or the UK, and you need to know a bit of information regarding their examination systems, then this is the video for you. I'm going to also talk about what are the costs involved and possible some immigration issues. This is going to be an overview video, and basically means I'm going to give you the lowdown of this whole process so you have an overall idea about how this is going to be. So, and we know that the USMLE stands for the United States Medical Licensing Examinations, and PLAB stands for Professional and Linguistic Assessments Board. It is also being called UKMLA. Okay, so UKMLA, if that is something that comes across, and both serve as gateways to practicing medicine in their respective countries, and they may differ in various aspects that we are going to be talking about today. And this is for global doctors who want to go to the US or to the UK. Let's talk about this today. All right, I'm Dr. Umar Khan. I am a practicing physician in the US. All right, for the USMLE, you are looking to get into residency in the USMLE. For PLAB, you are looking to get into the General Medical Council registration, and you are looking for your foundational training in the UK. Now, the USMLE pathway, there are going to be a couple of exams: USMLE Step 1, Step 2, the OET exam. So the USMLE Step 1, this is basic sciences such as pathology, anatomy, physiology, biochemistry, behavioral sciences, pharmacology. USMLE Step 2, this is for your clinical sciences, gynecology, medicine, surgery, and all that, right? OET actually stands for Occupational English Test. So the point to note about this is that both of these tests can be taken in your home country. You don't have to travel to the US for this. OET can also be, of course, obtained in your home country. Now, of course, there is a Step 3 also. However, Step 3 actually you can take later on. You don't have to take Step 3 for your residency, although in many circumstances it is preferred. We will talk about that a little bit later. Now, then after you are done with your Step 1 and Step 2, you are able to actually get your ECFMG registration. After that, you have an application process where you apply for the match. That's called the match, MATCH. That is the term that you need to know, and you want to meet, or you want to get your match. You want to be successful in this match, and that is called the match process. Now, then after that, if you match, you go into your residency training. Now, residency could be internal medicine, family medicine, general surgery. It could be emergency medicine. It could be gynecology, pediatrics. And usually it ranges from 3 years to 7 years. Internal medicine is 3 years. General surgery could be 5 to 6 years. So it varies. Psychiatry will be around 4 years, I believe. After that, you have an option to go for fellowships. Now, fellowships, depending on the specialty, everything will be different. Rheumatology will be different. Gastroenterology will be different. Cardiology will be different in the US. Now, moving over to the PLAB pathway. So you do this. Let me actually circle back a little bit. So Step 1 and Step 2, if you are fast enough, you can actually attempt these in your medical school. Step 1 can be obtained during your medical school. Step 2 can also be obtained during medical school, especially if your medical school is based on MCQ type questions. So this basically means that you could be ready during your medical school. However, most people try to do your Step 1 during medical school and Step 2 afterwards because you want to get done with your clinical classes. But that's just a recommendation, just a thought for you guys. So for PLAB, you also have to do some English tests, and IELTS and OET, as we discussed, are English proficiency tests. Then you have PLAB 1 and PLAB 2 examinations. Now, PLAB 1 is a theoretical knowledge-based examination, and PLAB 2 is actually more of a practical clinical skills test that you have to do in the UK. Subsequently, you obtained your GMC registration and foundation year 2, right? Then you have core training, lasts around 2 to 3 years, and then you go into your MRCP and your specialty training that could go for around 3 to 6 years. So you are looking at the durations. And as we discussed, the PLAB pathway is after you have graduated in your respective countries and you already have achieved a degree. Now, a bit more specifics about the exam. USMLE Step 1 will be first. So it is an 8 hours exam and 280 MCQs And as we discussed, it is basic sciences, and now it is pass and fail. Previously, it used to have a score. Now it is pass and fail. PLAB 1 is a shorter examination, around 3 hour exam, lesser MCQs, around 180 MCQs, and it is not basic sciences, it is clinical medicine. There is a score, but it does not really matter much. To note, if you're actually done with your USMLEs, this is actually accepted in the UK as well as other countries. I'm thinking also in Australia, so that is something to take note of. USMLE Step 2 also can be given in your respective country, and this is a 9-hour exam, a little bit longer than Step 1, a bit more MCQs. It is all clinical based as we discussed, and this is scored. Now, this for an IMG is going to be very important because this is the only score you're getting. Before used to you have Step 1 scores, but now you only have Step 2 score. You only have Step 2 score, so you should aim to get the highest maximum score in your USMLE Step 2. A couple of things that you have to note over here is that Step 1, of course, these days people are not giving it due importance, but if you manage to fail your Step 1, then that is a big no-no. Your chances for matching into a US program will be fairly difficult. So in the US examinations, you cannot fail. In the PLAB examinations, you could repeat, and that I believe does not go against you. So that is something to keep in mind. All right, PLAB 2, it is a clinical examination, and this is called an OSCE, which means Objective Structures Clinical Examination. It's a scenario-based and is clinically, and it is also scored pass fail. It is scored. However, pass fail is important and doesn't really matter much about the score. Now, the duration of preparation. So USMLE Step 1. So it depends. If you do during medical school, I mean, you do have to spend around 6 months of dedicated time. A lot of times individuals can use their basic sciences books in their country of origin along with their USMLE books. For example, USMLE First Aid or Pathoma. So they may be able to use the USMLE books to prepare during their medical school and attempt their USMLE Step 1. Step 2 actually also takes around 6 months of preparation. Of course, as I am recommending, make sure you are getting a high score. And if you really need to know about the study materials, let me know, and that will be a dedicated separate video about what study materials you will be needing for this. Let me know in the comments below. For the PLAB exams, it takes around 3 to 6 months. Of course, it depends how strong your clinicals are. And both of these exams take around 3 to 6 months. PLAB 2, you have to travel to the UK, I believe to Manchester. If this has changed, let me know in the comments below, please. Just to home this in, US has a residency, then you have a fellowship as we discussed. In the UK, you have the foundational year and then core and specialty training as we discussed previously. Now the pathways, the cost. Now the cost is going to be very important. The USMLE does cost a little bit more. I'm going to have a bit more of a breakdown of the costs. Higher costs, but you are able to get higher rewards. I'm going to talk about the rewards as well. PLAB, of course, costs a bit less. Trying to include all the costs, including travel costs in this expenditure. And keep in mind that this is over a period of a few years, not just a single year. PLAB costs are much more condensed because it is for a much shorter duration. However, PLAB costs are less. So the cost in the US, Step 1 costs around $975. CK is $1,000. Step 3, which you have to do in the US, you don't necessarily have to do it before your residency. However, in many situations, it is preferred. Of course, study materials do cost separate, and exam and testing and practice tests all cost separate. The costs are definitely a bit more than the PLAB costs. Now for the UK costs, PLAB 1 costs less. I mean, I have this in pounds, but if you want to look at dollars, I convert this into the US dollars, around 300. Of course, much cheaper than the USMLE costs. PLAB 2 costs a bit similar to USMLE Step 2. Study materials, of course, are separate, although, as I mentioned, generally cost less than the USMLE resources. However, then you move on, salary and lifestyle. Now, let's talk about salary first. All right, so you can see some more differences here. In the US, you're resident. When you are in your residency, right, you are making a little bit more, $64,000 per year. In the UK, you are making around 42,000 pounds, which in calculation comes to around 53,000 US dollars. So slightly less. Okay, if I can write this down for you guys. So this will be 53,000 US dollars. Slightly less, but the thing changes when you are an attending in the US. I wouldn't say roughly an average, but depending on your specialty, you could be making around 250 to 350,000. 250 to 350,000. However, in the UK, you are making much less, around 121,000 pounds, which will be roughly around 160,000 US dollars. So 160,000 US dollars. So you can do the math if you want as well, but you are definitely making less in the UK. Work hours, the US in your residency, I'm just going to talk about the residency work hours. You can easily work around 80 hours per week. Now, if working hard for your first 3 years is going to be tough for you, then probably US is not the choice for you. However, going through this, it is not that bad. The first years are going to be tough, but after your first or second year of your residency, that's okay. In the UK, it's 48 hours per week. So definitely there's a difference. US is 80 hours a week. UK is 48 hours per week. Now, the other issue is in the UK, the job market keeps on fluctuating. In the US, that is currently not an issue. If you match into your residency, then it is not an issue. Every year, one thing you have to note is that the US international medical graduate match rate is around 40 to 50% usually. Every year it changes a little bit, 40 to 50%. Some people do end up applying for the match multiple times on occasions. And I've seen individuals match after their second try or their third try. And those videos are going to be separate. You can also look at my channel about how to improve your chances of matching. You can look at the videos that I have over there, how you can be a better candidate. So things are changing. However, things do fluctuate. But you should, of course, do your research on this about job availabilities in the UK. Now, a few things regarding visa and immigration. This is not going to be an extensive discussion on this, and this actually needs a whole separate discussion. So let me know if you have questions regarding this, especially for the US standpoint, which I can talk about more eloquently. Let me know if you want to know about more. So to participate in residency programs, you need a visa. And common ones are the J1 and the H1B visas. Now, J1 is for considered, I just want you to understand the terminologies and we can go into detail in other videos. J1 is a visa for educational exchange, while H1B is considered a work visa. H1B is considered a work visa. So these have their requirements. The programs help you out. Just keep in mind there's J1 and an H1B. And this is what the programs sponsor. You have to see which program is sponsoring what. So just keep that in mind. Ultimate goal is eventually to get a green card. That is the permanent residency, and that is a process. We'll talk about that hopefully in some future video. Let me know if you have questions regarding that. In the UK, you are considered the Tier 2 visa. That is the general type visa. Largely a simpler process, but you do need a job offer from the NHS, that is the Natural Health Society or something of the UK. Anyways, just need to remember these terminologies: J1, H1B, Tier 2 visa, at least for this video. Again, nothing is set in stone. I'm going to share some final thoughts on this. Hopefully this gave you a general idea. You have to look at your costs, lifestyle, personal goals and preferences. What is your particular situation? Of course, both of these pathways have unique opportunities and challenges. Hopefully you are able to make a better choice for yourself. So again, before you make your final decision, you have to look at the scenarios for both of these countries. There's always a demand and opportunities for doctors in the US. There is a shortage of doctors in the US. The pays are generally more generous. However, it has been noted that the people in the US do work a little bit more than those in the UK. The work environment in the UK is supposed to be good. However, recently, due to cost issues, there has been concerns regarding that in the UK, and there is a question mark regarding the availability and long-term prospects. However, everything is manageable. See on the ground and talk to your friends and seniors who are already in the UK system. So of course, this is always a huge decision. Let me know what you think. Any particular questions? Each of these slides actually requires a separate video. Let me know what you are most interested in, and I will talk about that. Dr. Umar Khan here. Thank you so much. Let me know. Bye-bye.